Each year, thousands of people in the U.S. get sick from diseases that could have been prevented by vaccines. Some people are hospitalized, and some even die. People with diabetes type 1 and 2 are at risk for serious problems from certain vaccine-preventable diseases. Getting vaccinated is an important step in staying healthy. We are going to show a counseling session with a diabetic patient and a pharmacist.
Hello, my name is Cheryl. I'm a student pharmacist here.
Hi, I'm Stephanie.
Hello.
Nice to
How are
meet
you doing today?
I'm good.
Okay, and correct me if I'm wrong, but you have diabetes, is that correct?
Yes.
All right, that's okay. So did you know even if diabetes is well managed, it still can make your immune system fight harder against infection. So you are at higher risk from serious complications compared to other people without diabetes.
Okay.
Right? So some illnesses like influenza can raise your blood glucose to dangerously high levels. So it is very important for you to get the flu vaccine this year and every year.
Okay. Can you tell me more about the hepatitis B vaccine?
Certainly. So hepatitis B is a very serious disease caused by a virus, and it attacks the liver.
Mm-hmm.
The virus is called hepatitis B virus, or HBV, can cause lifelong infection, and it can cause cirrhosis or scarring of the liver, and it can also cause liver cancer, liver failure, and even death.
Oh, okay.
Yeah, people with diabetes like yourself have higher rates of hepatitis B rather than the rest of the population, just because of how the immune system works when you have diabetes, like I said earlier. And outbreaks of hepatitis B is associated with blood glucose monitoring procedures have happened among people with diabetes. Getting the Hep B vaccine stimulates your natural immune system to protect against the Hep B virus, and after the vaccine is given, your body makes the antibodies so that it can protect you for the actual real virus.
Oh, okay.
So it's really good, you know. Get them vaccines. It's really my biggest encouragement for you today. Another vaccine I want to talk about is the pneumonia vaccine. So like I said, people with diabetes, their immune system is not as good as the others. So you have a higher risk for this as well. Pneumonia is a lung infection, and aside from a lung infection, pneumonia, you also have a higher risk for bacteremia, a blood infection, or meningitis, which is an infection in the lining of your brain or the spinal cord. Now, there are 2 vaccines in the U.S. For pneumonia, and the one is PCV13, which is called pneumococcal conjugate vaccine, and the other one is pneumococcal polysaccharide vaccine, which is PPSV23. I know there are a lot, but all you have to know is you have 2 different shots for pneumonia, and you have they're in series depending on what your age is.
Okay.
These vaccines are good at preventing severe pneumococcal disease, which often require treatment in the hospital and can be deadly. And we don't want that happening to you.
Yeah.
We don't want you going to the hospital. We're here to help you out.
Thank you.
No worries. So another vaccine I want to talk to you about is that, do you know anything about Zostavax or shingles?
No, I don't.
Well, it will help prevent shingles. Now, these shingles, they're a very painful rash that develops along one side of your body, often in the face or the torso. Now, this rash consists of blisters that typically scab over 7 to 10 days and clears up about 2 to 4 weeks. So just imagine the pain you'll be having. It's going to be a long time. So it's kind of nice having this vaccine that actually prevents that, right? And it's called Zostavax or Shingrix. Some people can describe the pain even an intense burning sensation. And for some people, the pain can even last for months and even years, even if the rash goes away. That's a lot, yeah. So we don't want that. So you have this vaccine, it helps you prevent, so why not take it? So I have a question for you. Are you around young children a lot?
Yes.
Well, do you know anything about the whooping cough and all those pertussis? So whooping cough or pertussis are a very serious disease for people of all ages, but specifically and especially for babies. So whooping cough vaccines are the best protection against them. So it may not really hurt you, but if you don't have this vaccine and you got that disease, then you can transmit it to baby, and it can be very, very deadly.
Okay.
Right? So make sure you and your loved ones are up to date with your whooping cough vaccines, and there's 2 vaccines in the U.S. that can help prevent that. This is called DTaP or Tdap,
Okay.
and Tdap. Yeah. And these vaccines can provide protection against tetanus and diphtheria as well. So it helps you a lot. You have any questions for me today?
No, I do not.
So we'll get ready for your vaccines.
Thank you.
No problem.
Immunization provides the best protection against vaccine preventable disease. If you have diabetes, talk to your doctor or pharmacist about getting your vaccinations up to date. Thank you for watching.